Hello and welcome. My name is Dirk Pfeiffer. I'm Chow Tak Fung, Chair Professor of One Health at City University of Hong Kong and Professor of Veterinary Epidemiology at the Royal Veterinary College in the UK, both of which are partner organizations involved in the One Health Poultry Hub, which is organizing this webinar series. This is the 15th panel in our roadmap series, which is about discussions for the future of poultry, people, and the planet. And these fortnightly discussions address key issues for sustainable development from the perspective of nutrition security and the global poultry industry. We aim to contribute to the UN call that we build back better from the COVID-19 pandemic for the future we want. Before we start, I'd like to make some present some housekeeping notes. And the first one is, those of you that have actually participated before, is the discussion will take 1 hour. It will be recorded and it will afterwards be available on the One Health Poultry Hub's website, and a direct link will be sent to all registered attendees. Do please put your questions to the panel through the Zoom Q&A function. The chat function is not enabled for participants, so use the Q&A function, which you can access at the bottom of your screens. And feel free to vote for questions that you think are particularly important. So we encourage you, of course, to specify your own questions, but it's also possible to vote for particular questions which are already in the Q&A. And just to remind you, this is not an English language test. So don't worry about if English is not your first language. Feel free to enter the question that you have, and I'm sure we'll be able to then use it and express to the participants in the panel what you're intending to ask. Then we usually get a lot of questions, and therefore it's often not possible to actually ask all the questions. So I will try to do my best to get as many as possible into the discussion, but please accept my apologies if I'm unable to do that. We can also we will put them on the Slack channel, and then we can reply to them there, which is the last item. So this is not the end of it, really. We encourage you to afterwards join the online discussion channel that we've set up, and there's in your registration, there's a link to the channel, and we can use that for more detailed discussions afterwards. The topic of today's discussion is on food system governance, a risky business, and the expert panelists will explore the crucial issues in relation to what role can risk governance, the emphasis on risk governance, what it can play in contributing to food system policy. And before we start, before I introduce our panelists, we would like to your thoughts in relation to a question that you should now be seeing on your screen as a poll. The poll will disappear from the screen once you vote. I'll give you a few seconds. And I also have to do something. Okay, it is my pleasure to welcome our expert panelists for today. And we have Professor Meerjady Flora. She's Additional Director General of the Government of Bangladesh, Directorate General of Health Services, Planning and Development. She was the former chair of the Bangladesh government's One Health Secretariat, and she's the current joint coordinator of the professional NGO named One Health Bangladesh. Our other panelist is Professor Ortwin Renn, who is Scientific Director at the Institute for Advanced Sustainability Studies in Germany. Each of you has 10 minutes to present your thoughts, and we'll give you a singular 10 minutes, and you will then have 1 minute to wrap up. What I should say at the start is that Professor Flora, who is actually involved in the management of the COVID-19 vaccination rollout in Bangladesh, she has another commitment at past, and she may have to slip in and out of our discussion during that time. So we'll try to ask you a couple of questions right during those first 30 minutes, but I'm sure we'll be able to manage. So without wasting more time with introductions, over to you, Professor Flora.
Thank you very much. Thank you, Dirk. Good morning, good evening, good afternoon, whatever applicable to our global colleagues. And thanks the organizer for giving me the opportunity to speak before this August gathering. It's a very important topic we are discussing today, and I will be trying to be very brief and concise, and we can have opportunity to discuss later on. If we look into the food system and the overall our sustainable development goal, the food system not only focus on the eradication of hunger, rather it contributes towards sustainable development goals also, and it has connection with 14 SDGs out of 17. Next please. And if we categorize all these 14 SDGs, we can be grouped them into 3 main groups. One is related to food security and nutrition, inclusive development, and also the creation of a sustainable environment and to fight against climate change. Next please. And these food systems, as all of you know, that it's really a complex. The food system embraces all elements. It includes environment, people, different kind of process input, infrastructure, institution, market, and trade, etc. And its activities relates with the production, processing, distribution, marketing, preparation, and consumption of food overall. And food system involve multiple interactions among different actors and stakeholders involved at the different stage of food value chain. Therefore, it's not very clear, straightforward to have a governance over the food system. Next please. Therefore, we saw a few challenges in the food system, especially in the low and middle income countries. In many situations, either we don't have, or even if we have, that is not a comprehensive national food safety policy. Sometimes it's a big challenge. During development of these policies and challenge system, we focus on hazard rather than risk. Therefore, more often we lead it to the misallocation of the resources. Many regulation and standards are there, but yet to have clarity on the extent to which these are voluntary or mandatory. Fragmentation of in the responsibility we also can observe. There are lack of effective food safety engagement with the consumers, and at the same time, in the private sector, we have less focused on the empowerment and incentivize the private sector in case of to deliver the food safety. Next please. And one of the important areas where food governance can be ensured, that is to have a food policy that I already mentioned. The food policies that so far we have, those are fragmented. Food issues are dispersed over different policy domains like agriculture, health, society, different aspects fragmented. Many food policies are dominated by the productionist paradigm rather than having the user paradigm. Frequently, we have ignored environmental, social, and public health consideration and failed to reflect the essential reality of the biological and social dependence on food and the resources needed to produce its sustainability. Next, please. And this is another important area. We are limited in risk perception. Therefore, the risk governance issue is sometimes overlooked. And if we want to link with the public health risk in relation to inappropriate food system, it can focus on the risk of disease spillover over the human, we have different kind of foodborne diseases. We are now facing the antibiotic resistance issue, microbial and chemical contamination. One of the biggest challenges is genetically modified food, when we are focusing on the overproduction to increase the production of food. Food adulteration and misuse of food additives, these are different challenges. We have fertilizer, water quality and health issue, pesticide and the impact of those pesticides on the public health, the groundwater and surface water contamination, and cheap, low nutrient food from industrial farming. These are different public health risk areas where we need our specific policy. Next, please. So if we want to have food system governance, where we need to work, we need to establish a food policy that integrates different policy domains and driven by ecological, health and food security concerns. We need to establish food sovereignty to replace the global corporatist food regime, create inclusive policy spaces in order to strengthen adaptive governance, develop a new food policy that goes beyond food production and improves based on the environmental and health outcome, and create a coherent and sustainable food policy through policy integration across the discrete sectors and domains, including all the stakeholders and actors, government agencies, civil society organizations, and definitely food supply actors. Next, please. And all of us, we know that how can we achieve that when we have multiple sectors involvement in a single system? We need coordination, we need strong collaboration and cooperation with each other. And for that reason, next please, we need One Health approach. And as you know that Bangladesh is working as for One Health for a long time. It's one of the pioneer countries where we started to institutionalize this One Health approach. We have One Health Secretariat in Bangladesh, and also for consecutive 5 consecutive 2 times, we have developed our strategic framework where food safety and food security is one of the important components. And also antimicrobial resistance is an important component which is again linked with our food system. I would stop here and would be happy to have your questions later on. Thank you very much. Thank you for giving me the opportunity.
Thank you very much, Professor Flora, and you've been incredibly efficient with time also. Excellent, and a very nice overview and illustrating to us the complexity of the system. And I guess it doesn't matter which country you're in, we have very similar situations there, although locally the challenges will be different. Just one question to follow up. I mean, how do you think public health policymakers like you, because I mean, you've worked at that interface now for many years, can play a role in this complex food system governance issue and the development of a desirable food policy? I mean, you've experienced this for many years. I mean, and you're still doing it. So and you've achieved. I mean, it's my feeling actually, having worked with you for many years in Bangladesh. I mean, can you just talk to us a little bit about that?
Thank you very much. I think I have already mentioned about the importance of public health in overall food system, and also public health is we can ensure public health if we can have a good food policy and also have ensure the food security, nutrition, and also the food safety issue. Therefore, we have definitely important role, and specifically as because I'm working as Additional Directorate General for Planning and Development. Definitely we have important role in health sector. But at the same time, to bring all the partners and to make aware the policymakers, or better to say in the way, to perceive the risk related to this food governance, I think that is one of the area where we can go for advocacy, bring all the partners together and work together as not only public health personnel, but as also as a important contributor of One Health. Thank you.
Okay, thank you very much. And you tell you what, there are questions coming in, so we don't want to let you go yet. But what I would like to do now is just present the, I think we've got the results of the first poll, okay. So the question had been, who do you think plays the most important role in effective management of disease risks associated with food systems? And 45% of the people in the audience, they actually voted for the farmers and 30% for government. So, I mean, it shows, I guess, that is already an example of the diversity of stakeholders that are relevant in this particular context. So moving on now, Professor Renn. Let me get my, oops, where am I with my little quick sheet? It's your turn now. Over, the show is yours.
Yeah, well, thank you very much. I'm also very delighted to be here and to share some thoughts with you about specifically the health risks from a systemic perspective. And what do I mean with systemic perspective? It means that all these risks are much more interrelated and that we have cross-sectoral, cross-boundary, and cross-dimensional aspects of risk specifically associated with food threats. And what do I mean with systemic? Basically, we are trying to divide the risk field in two major parts. One is what we call the risk vector or the risk agent, and the other one is the risk absorbing system. What does that mean? Well, we have a multitude of causes for risks, and this could be something like zoonosis that we just have experienced right now. It could be something in food that you have bacteria or any kind of other problems associated with it. But if you take the vectors, those are the ones that will affect the risk absorbing system, there are only few left. And when we're talking about food, we have three physical ones. One could be that with food, maybe some energy release is involved. That's fairly rare. But then we have substance, and this could be chemicals, or it's biota, and that is fungi, that is bacteria, and that is viruses. And so those are the ones that are really the parts that can affect our health in a very negative impact. But we have social vectors. And I think that's important because we always have interactions between the natural and the social vectors. And the social vectors are basically information. So information can actually kill. If you have wrong information about food safety, for example, you do the wrong thing in order to protect yourself. It's power, and that has been, I think, very clearly mentioned already in Flora's talk just a minute ago, that if the power is distributed in the wrong way or exerted in a very problematic way, it can also have major impacts on risks and on risk governance. It is potentially violence, which is associated with power, and it's money. So it's also the major agents. Now, what does that help us? If you look at these agents, we have interactions between them. And that means very often we can see that we have so-called risk cascades. And that could be, when we talk about the pandemic right now, it might have started with the food system. We're not totally sure about this, but that's probably the most probable hypothesis. And then it has, of course, gone over to a health system. So it's viruses that go into the health system. Depending on power and information, it had been aggravated, but then it also cascaded into other areas. We have a lot of economic hardship coming from that specific pandemic. We have problems with educating our children because schools have been closed. We have problems with social isolation. We had increase in domestic violence. So we suddenly see that there are whole cascading aspects of risk that we need to take into account. And it's much easier for risk governance to deal with one risk at a time than with multiple risks at the same time. Now coming to the risk absorbing system, and that is a target of the risk vector. And normally we talk about human beings, and that of course is the most important element in terms of health, but it could also be ecosystem quality, so any kind of environmental risk that we may face, but there's also other kind of social risks or political risks, or a risk about political and social and individual identity. All of those are kind of targets for these vectors, and it's very important also to think about the target that is being affected. Now, what does that mean specifically for the food risks that we're talking about? The first thing is that many often food risks are not single risks. There are multiple risks. And these multiple risks always unfold in terms of health impacts, economic impacts, social impacts, and political impacts. We've seen food wars between different countries, sometimes triggered by food safety scandals or food safety problems. And we can see it right now again a little bit between China and the rest of the world, and with many other food-related risks that have become social and political triggers for crisis. And I think it's very important to include that into our analysis. It's not just about human health, it's also about many other factors and goals and objectives that people value. So that's the first element that we need to take into account when we talk about food system. The second one is that food safety, nutrition, food security are all very highly correlated. It means that we often talk about food safety, but the more serious element is probably nutritional value. And we can see that wrong nutrition kills many more people than contaminants in food. But it's totally different from risk perception. People perceive that the contaminants in food are the ones that kills them. If they overeat, if they are eating not enough whatever, and that can be due to poverty, but it can also due to just the opposite of having too much food available. All of that can have major negative impacts on our health, and many more people die because of wrong diet rather than about food safety issues. So that's the second major point, that we put things into priority. And the third major thing is that this kind of perspective helps us to communicate better. We tend to communicate just about viruses and bacteria and their impact on our health system, but we are not talking too much about what is the food system like, how is it organized, how is safety being governed, how it's being managed, why things go wrong in some places or not, and what can we do also to protect ourselves. So the consumer is also a very important element there. And I think if we can get that systemic view also into our communication, we may be much better to have all the people who are involved, all the institutions, all the customers, the merchants, the farmers, that they take their part of the responsibility. It is not possible to place all the responsibility on the government, on the regulatory system. It is also not fair to put it all on the farmer. I think we need to make sure that we have a divided system of responsibility, or shared system, maybe even a better word, in which each of the representative of each part of the value chain is taking some responsibility in the domain in which that responsibility can actually be effective. So these are my three major lessons that I would like to tell you. First, there is this a very good thing of systemic view, because you extend the amount of the kind of risk concerns that are in the world. Secondly, it's very important to say that nutritional diet is a much more important factor, and that you set the priorities right. And thirdly, make sure that the communication is about the entire value chain and about the shared responsibilities of each of the constituencies. Thank you very much.
Thank you, Ortwin, for that excellent overview. And I think it nicely connects with what Professor Flora has talked about before. Can I ask you one additional question? I mean, you've talked about the terms risk vectors and risk absorbing systems, which actually I hadn't thought about yet myself. And you use them as base units for systemic risk governance. Could you explain these two units by referring to an example, please?
Yeah, I think we can take, for example, the pandemic right now, because we're all very much familiar with it. So if you look at the vectors, I mean, the first one, of course, is a virus. And that virus, of course, has taken a very deadly toll on human health. but it has triggered other types of cascades, what I would say, and those cascades are that the virus then turned into an economic crisis in many countries. So suddenly we have a new vector, money, which is of course reduced from the economic system that leads to poverty, leads to unemployment. Unemployment, interesting enough, leads again to major health issues. We all know that the correlation between unemployment and life expectancy is one of the highest correlations that we have in the world. So again, it's not that it's money versus health, it's all interrelated. We can also see that several people who had been, very afraid or very scared by the virus have been home and haven't moved, have partially dehydrated. So there is an energy lack involved, and that has also led to serious health problems in specifically the elder population. And we can see that also in some issues, people have, because they were afraid of eating specific food, it's not so strong in this pandemic, but in others, and then they have taken the wrong substances and again were deeply at risk. And then we can definitely see that different power systems in the world have done, a very diverse a policy mix. If you think of some countries have not taken the virus very seriously or have put the trade-offs strongly on side of the economic recovery, take into account that many more people will die than necessary, that has, of course, had a strong impact on people's approval to governance and also to even sometimes domestic violence. So we can see that these kind of cascades are very well describable and very well take into account when you look at the vectors, and there's only those 7. I mean, the good thing is there are not more, and you can see their interactions, and that is also a tool if you want to improve resilience. You can say, well, let's just take any kind of hazard that comes up and just see all 7 vectors are involved. What can we do to make my system more robust, more resilient against any of those 7 and any of those combinations? And the second point, as you said, with the risk absorbing system, very often we are, almost in a tunnel view on just one target, let's say the individual human health. Sometimes we forget public health issues there because they're not always the same. We forget that there are a lot of other consequences, economic, social, psychological, that we need to take into account. So this is also helps us to widen our view without getting lost, let's say, in the multidimensionality of the world.
Okay, no, thank you for that explanation. Shall we start also keeping in mind that Professor Flora might have to dip out for a few minutes during the next half hour, and I'll ask her one question, and that's, you did actually, Professor Flora, you mentioned One Health in your presentation. Can you talk a little bit about more about its role in the context of food system governance?
Thank you. Thank you for a very important question. And because we are working for One Health for a long time, you are also one of the pioneer of that initiative. So I would love to answer and elaborate more on the One Health aspect. Whenever we talk about any food system governance, I think it's better to identify it as One Health food system governance and policy. Otherwise, it might not be properly handled and properly addressed. So, as One Health perspective, I think we need to have a few basic principles which we have already. I mentioned that we try to address in our One Health strategic framework in Bangladesh. One of the important components is the food safety issue, as already we have mentioned that, and also Dr. Renn mentioned about it. So regarding food safety issue, I think this is one of the important area where I think we need to bring many partners here. So actually food safety is everyone's issue. Food safety, we need to ensure the food value chain, as we mentioned earlier. And also, if we want to ensure food system governance, even if we focus on this governance specifically, we need to think about as a whole of the system or whole of the total system approach. So One Health definitely focuses on that. So we have interdependence, we have interconnection among different stakeholders, different sectors. So that is also a very important in terms of One Health perspective. And also not only on the public health issue, although I have mentioned public health in my presentation, but it's not only public health, we need to focus on the welfare of all species, including human. And we need to preserve all our lives, like the wildlife, those who are now struggling to survive because of deforestation and other issues. So as a whole, and as I already mentioned, that food safety or food system includes agriculture, it includes industry, it includes poultry, and we are working as One Health Poultry Hub also. So whenever we want to ensure food security, food nutrition security, remove hunger, and as well as ensure safe food, I think we need to have One Health approach, definitely. Thank you.
Thank you, Professor Flora. I mean, we've got questions from the audience, but what I'd like to do now is I'd like to actually pass the same question on to Professor Renn, because I mean, you know, the thing is, I mean, it's I'm a veterinarian and Professor Flora is a medical doctor, so we come from the human and animal health perspective, and One Health has been enlightening to some extent for us, and I just wonder how you look at it from your perspective, because you come from a different angle. Do you think this has been a useful development, or in the context of improved risk governance for food systems and beyond, as what you've talked about?
Yeah, absolutely. Dirk. The first thing is that I think the One Health movement is the same as the planetary health movement. There are two very well-connected ones, have made it very clear that first veterinary and human health are closely related, and that there's not, you know, there is of course a difference between the two, as we know, but still there are a lot of commonalities. And secondly, that environmental health is also an important part of it. And I think that's also something that we need to take into account, that we're all part of our natural environment. We are not, you know, above it, and we're also not beyond it. It's a part of, you know, we need air, we need water, we need material, we need food and everything else. And that's part of a functioning natural system. And so in that sense, it's very important to make those links. And I think the other part is what I would like to stress is that everything what we do is embedded into a social cultural context. And I think that's extremely important to also acknowledge this, because very often, you know, we think about solutions that work, let's say, on a very physical or natural science base, but it doesn't work within the culture in which we would like to embed these kinds of measures. And so I think we have a triangle. We have the natural environment, we have the social cultural environment, and we have the economic conditions. And all risks develop, in a sense, in this kind of triangle. And there are very few risks that we can locate only in one corner. And I think we have learned to look beyond one corner. It's good to look at one corner, you know, in an analytic sense, because, you know, we cannot talk about everything at the same time. However, I think it's very important to see those cross sections and to see those interactions between these various elements. And I think the One Health movement is a very important element to broaden that view and to make sure that we integrate the various elements of other risk sources or risk vectors, that I've called them, into our analysis.
Thank you. I mean, I'm glad you brought in the social sciences, really, because I've always, my view has always been the One Health, the way how it's framed often, it focuses on the biological sciences, really, or the natural sciences, one might say, and it actually doesn't consciously integrate the social sciences. And you've just explained that that actually has to be part of it. Okay, now let's ask some questions which came from the audience, and we've got one which was Renn's highest, which is from Dr. Rashid Mahmood, and he's written, the question is, the COVID-19 crisis has exposed the fragility of current food systems, especially in developing countries. The current food systems, which are dependent on a lot of international food trade, are threatened. What should be our approach to overcome the future food crisis, as well as ensuring global food security and achieve the Sustainable Development Goals? And if possible, I'd like Professor Flora to try to answer the question. I'm not sure, she might be in her other meeting. She's going to multitask in this half hour. I think she's probably occupied. Ortwin, do you think you can comment on this, the issue of the global food system fragility?
Yes, I think that's a very important issue. And I think, we haven't talked too much about food security, because that, of course, is a major issue, because basically, we will not survive if we don't have food. So food security is actually the first priority. And secondly, of course, there's nutritional value. It's not just food in terms of quantity. We also need a specific quality of food. And then it's food safety, which I think is the third element here. That's very important. And what we can see is that, sometimes these things are in conflict with each other. So we know that sometimes we have to compromise food safety in order to get people fed. And nutritional value very often, of course, is a part of the economic system and the distribution of wealth. If I don't have any money, I have to afford the food that I can afford. And I think another question, the chat addressed it very drastically and said, well, if I can't afford good food, what can I do? And I think that those are a very important element that we need to do. And there's a lot of risk cascades. We know, for example, if you lack a lot of good nutritional food when you're young, that has a major impact on your development of intelligence. And for the whole life, we have a person that cannot really develop in a way that it was meant to be. So in this sense, I think we need to look at this triangle, a couple of triangles, unfortunately, very often in the saying, well, we have food security, which of course has priority, because if we don't eat, then nothing works. Then it's really food quality and food safety, I think, are on a similar stage. And very often, I think, again, we have institutions that only look into food security, don't care about the other two. We have institutions that look only to food safety, but disregard that maybe food security is compromised. And so in a sense, again, this is a very strong plea to put these three, always into your perspective, and to see that, health is also related with having something to eat. Then, of course, what you eat is very important. It seems trivial on the first glance, but I've looked at a lot of, food agencies and others, and very often found that there is not a real discourse between those who are responsible for food security, very often agricultural ministries and agricultural agencies, and those for food safety, which are very often, in health ministries or in environmental ministries, and they fight against each other. It's not, or they just, or even worse, they don't correspond with each other. And I think that's part of the problem we need to overcome.
Okay, thank you. I don't know, is Professor Flora, are you back in business? I'll have to keep trying. This is slightly awkward, but we'll just have to keep trying. Okay, seems offline for the time being. So it'll be you, Ortwin. Another one. But it's, I think it's your inputs are very important. And I'm going through the list here, and I have to say I'm jumping a little bit up and down of questions have been asked. There's one from Dr. Barbara Hessler, and she's asked, desired food system outcomes sometimes clash. For example, the desire to increase livestock food for more animal protein and economic growth, and the protection of biodiversity and wildlife on the other hand. Okay, so those two. So animal protein and economic growth versus protection of biodiversity and wildlife. And then this results in a reduction in land use for animal, through a reduction in land use for animal agriculture. With these very contrasting agendas, how can a middle ground be found? Can it be found? Because, and I think that connects with what when you talked about the different objectives, the different themes, the different threads, and how you need to look holistically at the questions. Over to you.
Yeah, well, thank you, Dirk. Well, I think this is, right to the point. I mean, there is no way to avoid trade-offs, and we do have conflicting goals. And I think everybody says, well, everything is in the same line. Basically doesn't understand the intricacies of the system. And you can add to this. I mean, if you take livestock, I mean, one is biodiversity, because, you're needing more land use, and specifically for cattle. Secondly, of course, is climate change. I mean, we have methane problem. I mean, and that's an increasing problem in terms of climate change. We also have a food problem here, because too much red meat is not good for your health. So that goes into one direction. The other direction, of course, is that people love to eat red meat. And even those in cultures that have not been used to it, once they taste it, they seem to be very affected to it. And that's not the advertisement. I mean, that's what people sometimes say. It's just because it's advertisement. No, we know for physiological reasons that red meat does have a good taste and people like to eat it. So, and it also has, of course, some nutritional value. Too much is not good enough for it. And so, I'm sorry, this is me. So there are, and of course, there's economic things. I mean, as you said, I mean, a lot of economic well-being depends on cattle. And so, yes, we have to make trade-offs. And I think one of the things that to resolve trade-offs is to think in terms of time. If you do everything at the same time, you basically ruin one over the other. If you try to make plans and to say, well, we have to reduce red meat and even, milk in, some modest forms in order to, go ahead with biodiversity and to specifically combat climate change, we can't do it overnight. But at the same time, we know all the vectors there are going towards more meat production, and that definitely is not a good idea. And the poultry industry, I think, is somehow a little bit in the middle, because it doesn't need about land use. It's not really problematic in terms of climate change. But of course, even there, you have to think about, how much growth there is still compatible with sustainability. And those are difficult questions to raise, but the questions need to be raised. And I've been very glad that these questions came up in the question and answer period. And there is not a single good answer. It has to be negotiated. And I think Professor Fona made this very good point that we need better cooperation and more coordination, and of course on a global level. And that's not easy, as we know. All industries and all national governments have very often different goals and different objectives. But in the end, I mean, if you talk about one health or one global health, there is no other solution than to sit together and to make those trade-offs together, and then develop a plan in a sense of what can we do in what time without hurting our economy or our livelihood too much.
Okay, now, thank you. Robin Alders actually would like to also make some comments in relation to this particular question. Robin, over to you. There she is.
Sorry, Dirk, you've caught me by surprise. Yes. Thanks very much for the excellent presentation so far, both Prof. Flora and Prof. Ortwin. The big question is, how do we get these international groups to work together? How do we break down national boundaries so that we can do this and really do risk management in a significant way? It's not just the separation between the disciplines. It's finding a way for countries to work together to really implement a One Health approach that in the end will reduce the pressure on national budgets. At this time of COVID, where many people have seen difficulties accessing food in their local environment, in some cases, it's been a great wake-up call. How do we use this as an opportunity to bring people together? So I'd like to throw it back to both Dirk and to Ortwin You both of you work with international organizations. What do we do? How do we get them to discuss this and to take a very interconnected approach that will solve problems both in terms of food security, and management of food safety and pandemic risks? So back to you two for a question, or for an answer, sorry.
Thank you, and I'll pass it on to Ortwin to give it a start. Because I mean, just to add to that, I mean, Ortwin, you also mentioned the term of a global approach, and I've been using the term global One Health risk governance actually as something we should aim for. And it's one thing to say that, and we can have these ideas, but how we are actually going to do it, how we are going to convince the key stakeholders, the countries, the organizations, the industries to actually engage in a global approach. Do you have any suggestions there, or ideas or perspectives used?
Yeah, well, as you said, Dirk, this is not an easy task. And we know that very often, if you try to get everyone involved, nobody is involved. So, and we've seen that in all the negotiations about global climate change. I mean, that's the one that I think has most progressed over the last years. And we have the Paris Agreement and others. So there are some ways to get along with different countries and different governments and different systems. I think what we need to do is probably a coalition of the willing. If we get those countries together and say, well, we see that there is a problem, we see that we all benefit from a very good international regulation and a good plan, to proceed. And if that is a good example for others, they will probably follow. I know we have always a problem of the easy rider who then says, okay, I don't follow these rules, and then I can be on the market with cheaper product. That's always an issue. But if you have enough people or enough countries in that case, that would come together in the coalition of the willing, then it has a very strong geopolitical strength. We've seen it in some areas, the CFCs, that went very well with such an approach, and we got a very good international, globally effective regulation. We've seen it in others in terms of the Cartagena Protocol and so on. So it's not something that I would say we've never seen before, but I think in the food sector, it's more sensitive because there is a lot of emotions also associated with food, and a lot of political clout. I mean, Europe is already, defending its agriculture against everybody else, sometimes even with means that I would think is not very fair to the outside world. We see that also in many other countries, United States, China. And it's not easy to come together. But I think, the more the problems come up and the more the world gets interconnected, the more I think everybody needs to come to the conclusion that it is much better to cooperate here rather than to go on a perishable competition.
I guess from my angle, I've done a lot of work with United Nations organizations, and particularly with put it this way, the OIE, which is the World Organization for Animal Health. That's not a United Nations organization, but it looks after trade and also, I guess, food associated with that, but then also with the Food and Agriculture Organization and a little bit with the WHO. Mm-hmm. And I just wonder whether they might be an impediment. Are they an opportunity? Are these organizations, what role could they play, or is it actually a disadvantage? Is it like when you have the G7, you've got the European Union, you've got blocks of countries? Is that what you might want to call the coalition of the willing? Whereas these big global organizations, they may find it very hard to come up with something that approaches what we need for effective global One Health risk governance.
Yeah, well, I think it's an opportunity and a problem. I mean, the problem is we have a lot of international entities, and they've also compete against each other. They produce millions of papers and nobody reads them. That's a little bit exaggerated, I know, but and also in other areas in which that's the case, and on hazard control, on the Sendai protocol, whatever, you have, you know, thousands of acronyms. Nobody even know what those acronyms mean anymore, of, you know, very well-meant initiatives. But at some point, I think, you know, if you have too many initiatives, nothing will happen because they paralyze each other. So I think we need maybe really strong incentives from the G7 or G20 to say we want to look at it, and we would really authorize one of these, you know, well-developed initiatives to go ahead. Because otherwise we have the problem that all want to be the ones that come up with the good solution, and then, you know, they catalyze and not catalyze, they paralyze each other. And that's a part of the problem that I can see. And I know that they're all, you know, individuals in there, sometimes individuals in many of these initiatives, the same people, but with different roles, and it's not very efficient. So my feeling is that we need to be probably a little bit more selective into saying, okay, those are very important initiatives and we need them to strengthen them, but they also need political support. And that's something where I also feel sometimes that politicians, if they don't want to deal with an issue, they start to initiate a new commission. And that's the kind, you know, the usual policy advice. If you don't want to make a decision, create a commission. And so we have millions of commissions. And if the politician still don't want to do it, he extends the commission, or he adds another commission to the already existing commission. And then we see this all over the place, specifically in the European Union. You know, we have hundreds of commissions, scientific commissions, non-scientific commissions, cooperative commissions, and so on, comitology. And very often, if they don't get an answer, we get a new commission. Or an additional commission. That's not the answer, I'd say. So in that sense, I think a little more streamlining, and to make sure that you know, the government heads say, we'll see the problem and we want to make this problem, you know, to be resolved in a peaceful and a very constructive manner. That's important. Then they also have to streamline the institutions.
Thank you, Ortwin. I mean, I'm following the Q&A a little bit, and I have to apologize to most of the people asking questions because they were targeted at, specifically at Professor Flora. There's one here that came from Kees Vermeeren, and he's been asking about the tension between private standards and public standards. And he was wondering whether that's actually the increasing emergence of private standards in trade, that might be an opportunity. Or do you think, because I mean, a lot of what we've talked about was about the government's doing something, or at least that was my impression, maybe not. But I mean, but it's the industry is also industries are very active, and they operate globally, many of them, and they are developing standards and they're implementing standards. What do you think about that?
Well, I think first it's extremely, I mean, very welcome that the industry, you know, takes initiative here. And this is, I think I would applaud this very much, because to some extent, this is a risk also for industry, because they cannot, you know, enforce compliance. So if you have the so-called black sheep somewhere, they can make all the profit in the world because they don't keep to the rules. And that, of course, is a risk anytime. So I think in terms of industry, industry is much better off if they have clear international regulations, because then they compete all on the same level. But within that kind of, let's say, confinement of international regulation, they can do a lot in terms of voluntary agreements. And I think that's also show or demonstrate their willingness to really protect health of the people. And it's also, of course, good reputation management and everything else. So in that sense, I think industry is very well advised to go beyond what the regulation is. But I would be very skeptical of saying that industry self-regulation can substitute international regulation, because, you know, it's a compliance issue, and you always find some players that will cheat. And if there's no compliance rules and if no regulatory rules that can really be enforced, then of course you will always have the black sheep problem. And in that sense, I think it's important to have good international regulation. They should not be too strict, and in a sense, and should have a good timely convergence space so that people can adapt to it. But within that guardrails, or within that guardrail, I think it's a good picture. The guardrails are the regulations, so people don't go off the street. But how they will move on the street between the guardrails is something where creativity and ingenuity of the industry is really welcomed. And then, of course, also the efficiency of market economies is unbeatable. And so we should have enough space for that kind of market creativity.
Thank you. And I guess emphasizing that you need both, really. You need to have the right balance between the two, which is where with, I guess, globally operating companies, it can be tricky. But that's also where there's a role for international organizations. We've almost had our 1 hour, and I've got another question, which is actually, a personal question that, it's not really personal, and that's the role of ethics, It's something that I really struggle with. How do you fit? Because, when you look at, for example, and COVID is only one example, when you have to make decisions about people's lives and livelihoods, lives, and about the economy, about mental health, etc. How do you integrate an ethical perspective? And I know that in Germany they have an ethics committee, or I think whatever the English name is for
yes, yeah.
that actually provided some guidance also to government, and I think that's very important. But it is incredibly uncommon to have that. So where does that fit into your concept of risk governance?
Well, absolutely. The one thing is, you can act ethically or unethically, but you cannot act non-ethically. Everything what we do has some kind of affiliation with moral values. And a lot of the things when we talk about trade-offs, we think about, there's one moral value that we really appreciate, and there's another one, and they're in conflict with each other. So moral dilemmas are the most important elements. And then, ethics can help us to find a good way through moral dilemmas. If it's morally clear, if you killed someone without any reason, nobody will say that's a moral dilemma. That's just bad action. And we see that also, and that's kind of criminal acts and other kinds of things. If you have moral dilemmas, then it's very difficult. And if you said before, you have to, in this pandemic, you want to save lives, but at the same time, you don't want to compromise your economic performance. And you have social consequences like lack of education for young people. You have an increase in domestic violence. All of that happens at the same time, and you have to make trade-offs. That's no way you can avoid it. And that's why I said you cannot act non-ethical. You can either make prudent ethical decisions or unethical decisions. And then I think good ethical guidance is very, very important. And it helps you to make better trade-offs. And I think that's the common line. I think very often we resolve trade-offs by just avoiding to look at conflicting goals. We're just focusing on one goal, and then we're saying we optimize and maximize that. And anytime we maximize something, we will compromise on something else. And in an interconnected world, everything seems to be associated with each other. And that makes it more difficult to make prudent decisions, but at the same time, I think it demands also more ethical reflection.
Thank you. And I know I need to finish, because we could continue that discussion. But for me, this is really important, this ethics issue, because I think that's where policymakers, they're struggling with that aspect. And I think we also need to provide guidance, or we need to have ways of dealing with that in a more systematic way. So thank you, Ortwin, for this. This is a little bit of an unusual way of running our panel discussion here, and both Professor Flora and you handled it really well. what I will do now is we'll just show the key messages actually that we had on the screen. And I'll just go through them quickly. So we've got some key take-home messages based on the presentation by Professor Flora and Professor Renn. And the first one is food system governance is a complex and multi-level issue involving multiple interactions between different actors and stakeholders at different stages of the food value chain. Second, food policies should avoid being fragmented and dispersed over different policy domains and should not be dominated by a productionist paradigm. The third one, food policies should integrate different policy domains driven by ecological health and food security concerns, integrating across discrete sectors, domains, and actors. The One Health approach can play an important role in this respect. The fourth, human and environmental health is not a one-dimensional issue, necessitating a systemic approach to risk assessment and risk governance. And the fifth is scientific knowledge for both assessment and governance is crucial, but not sufficient for understanding the complex impacts of human actions and natural events. Experiential knowledge and often tested knowledge are required to learn more about the context in which the risk manifests itself. Many risks, and this is the last one, the last of the sixth take-home message, many risks are interconnected or operate in cascades. Risk governance relies on multidisciplinary contributions and an ethical appraisal about the level of interventions in the natural and social environments that are deemed acceptable for people affected. And I see now that Professor Flora is back online. We've run out of time. There are quite a number of questions which we will try to then maybe reply to in the Slack channel. So, but thanks to both of you for taking part. And what we'll do is before we finish, we want to get, we have another poll for the audience. So here it is. So which of the following do you think is the most important constraint to more effective risk governance of food systems? Choose one option that best represents your views. Siloed mentality of government institutions, or weak public-private relationships, or consumer demand for cheap food, or globalized food systems, or inappropriate food price signals for farmers, processors, and manufacturers. We realize that all of them play a role. We would like to hear from you what you think is the most important of them. Okay, now, thank you again to both panelists. And this has been like we're learning with each of them, each of those panel discussions. Yeah, this has been a different format again. And I have to say, both of you handled that really well. And we've been able to fill the time without a problem. We could have talked a lot longer, which I think is a good sign. And I also thank the tech team in the background that was sending me messages while I was trying to balance between questions and thinking about what to do next and listening to the responses from our panelists. But also thank you to the audience for your interest and questions. And if you have time, please continue these discussions on our Slack channel using the link that you received at registration, or you can access it via our website today, tomorrow, or whenever you have time. And now we should see the next event. Okay, so just a little bit of a plug for the next event. We look forward to welcoming you again in 2 weeks' time on 21st of July at the same time for a discussion between Professor David Heyman of the London School of Hygiene and Tropical Medicine. He's a distinguished fellow at Chatham House and former WHO Assistant Director General for Health Security and Environment. And Dr. Victor Mao, Senior Program Specialist at the International Development Research Center. And the discussion, the panel will be moderated by Dr. Syed Abbas, and it will be about the topic food system governance and the food disease environment nexus. And we should have the results of the poll. Do we have the results of the poll? Yeah, there we go. So number one is inappropriate food price signals to farmers, processors, and manufacturers. That's interesting, actually, because but there's a bit of a balance. I mean, the other 23% siloed mentality, and the other one that got about 26%, so is weak in public-private relationships. So I think that's a reflection of the discussion, and it actually illustrates also the complexity of the challenge that's ahead of us. and we need to, I guess we need to deal with it and also integrate it at the national levels, but also at an international level. So thank you very much, everybody, for the discussion, and also putting up with the fact that I didn't answer or use all the Q&A questions. I had to improvise a little bit, and just stay safe. Bye-bye.